There are a lot of different reasons that we decided to switch from paper to electronic. The government is moving in that direction, and they're wanting everyone to do it for a lot of different reasons. But more than that, it just makes good sense for us. The electronic medical record helps our providers to be able to document a lot more accurately. They're able to go into a patient's room and come out and document quickly. When a patient comes in, we have them sign in up front, and the information goes into the computer by the people at the front desk. Then they're brought back to the room, and our medical assistant takes some of their history of their present illness. Do you have pain? What kind of pain you have? What kind of medications you're taking? Have you been seen by any other physicians? Our medical assistant puts that into the computer. So then when our provider, our PA, our nurse practitioner, our physician comes into the room, all of that is displayed on their tablet computer. So it's all shared information. They can write a prescription and send it to your pharmacy right from sitting in front of you. Their orders that they give for a CT or MRI goes up to the front desk. So it's really a great system, and it saves time. You're not walking around looking for charts, looking for messages to one another. Everyone communicates right from that piece of equipment that they're holding and walking around with. Our patients can actually have a finished form of their note for that encounter done and ready to be printed out, and sometimes even faxed to the referring provider before they even leave the parking lot. In the old paper world, the document would have to be usually dictated, sent to the transcriptionist, sent back. The provider would have to sign off on it, and then sometimes 2 or 3 days later, or maybe even a week later, sent out to the referring provider. If the patient is on a particular medication and that medication is recalled, we get a notice. We can do a search and within just a few seconds find every patient that is on that medication, has ever been on that medication, printed out and in our hands. In the old paper world, we'd have to have people come in, look through every chart, look through every piece of paper in every chart, and find out if any patient was in danger of being on that medication. Now we can do that instantly. The communication between us and referring providers is just much better now than it ever was in the past. We have a patient portal, so the patient can access this information also. They can go onto our website and they can sign up just like you sign up at your bank, and you can get your banking information here. You can sign up for our patient portal. You can put in your name and your PIN number, some identifying information, and then when you get home, you can get a listing of your medications that you're on. You can get a listing of certain other information such as diagnosis, some of your, maybe your lab results. You can do things such as send confidential messages to your physician, get some answers back on there. You can make appointments online. So there's some really good things that you can do online to reroute and skirt some of the time waiting on the phone.